For 10 months in 2020, Celia Juarez had extra weight on her shoulders, 2.2 pounds to be exact. That's the weight of the personal defibrillator her doctors ordered her to wear 24 hours a day, 7 days a week.
The only time you take it off is to take a quick shower.
Commonly known as a life vest, the device is worn by patients at risk for sudden cardiac arrest. With a functioning heart rate of 25%, Celia was certainly vulnerable.
The life vest is there to save your life. If you go into cardiac arrest, it's going to shock you. So by the time the ambulance comes or you go to the emergency room, it's shocked you and you're probably not dead.
Celia's heart issues started nearly a decade earlier when she began experiencing an occasional sharp and dull pain in her torso, as well as a fluttering sensation that felt like butterflies in her chest.
Well, the very, very first time I felt some type of pain, I got scared. You get scared, but then once it goes away, you're like, oh, it's nothing. It's probably my mind or something. I don't know. You think of it might be something I ate. And then later on, I guess I just got used to feeling the fluttering, the little sharp pains. I didn't think to go to the doctor to get checked.
But in February 2020, the fluttering sensation began to worsen, and the 49-year-old school teacher started to develop a cough and other flu-like symptoms.
A week after that, I ended up in the hospital for severe nausea and severe dehydration.
After telling doctors about the fluttering sensation she'd been experiencing for years, Celia underwent several tests, including an electrocardiogram, which measures your heart's electrical activity. She received an abnormal EKG reading, signaling a potential heart issue. After additional testing, Celia was diagnosed with congestive heart failure and cardiomyopathy.
Well, the first thing I thought was, I don't want to die. My girls, I have 3 daughters and they're older, but I still want to see them graduate from college, graduate from high school. I didn't feel that I was ready to leave, and I knew I had to do something.
In August 2020, Celia, who was advised to improve her diet and exercise, enrolled in the South Texas Health System Intensive Cardiac Rehabilitation Program. Launched in June 2020, the first of its kind program in South Texas was developed in partnership with Pritikin Intensive Cardiac Rehab, offering 2 times the Medicare covered sessions versus traditional cardiac rehab. The program aims to strengthen your heart and body. It focuses on 3 key pillars: regular exercise for improved cardiovascular endurance, increased strength and flexibility, and enhanced overall health; a heart-healthy eating plan with affordable and satisfying meal options with simplified cooking and dining out options, all for successful weight management; and a healthy mindset with lifestyle change education that's centered around stress and anxiety management, as well as practical real-world training in healthy habits. The end goal of this comprehensive cardiac program to reduce a patient's risk of another heart event while increasing their heart function.
A lot of cardiac patients actually require cardiac rehab. Classic examples would be like whoever has congestive heart failure with low heart pumping capacity. We call it as low ejection fraction with congestive heart failure, or any recent heart attack. Whatever we do, it won't improve the heart pumping capacity with just the medications. Some amount of exercise is also needed, not like heavy exertion or something to strain the heart muscle, but some amount of like stretch need to be there for that to improve the pumping capacity.
For Celia, taking part in the program has not only helped improve her heart function.
Just this last Friday, I found out that my heart is at 45%, and I am officially off the life vest.
It has also improved her perspective.
I do the best to be as positive as possible, look at life in the most positive way. That's what they teach you. They teach you that exercise is good for the mind and for the heart.
And she credits the South Texas Health System Intensive Cardiac Rehabilitation Program staff for helping her.
I love the people who are here. They are very professional, very positive, very friendly. I love that they're with you at every step. On the treadmill, they're right there, making sure you don't fall, making sure you feel, you're okay. On the bicycle, they're right there, right next to you. I love that. I love that you have that support. They're there to support you, along with your family. But when you're here doing the exercise and the program, they're right there, always smiling. And if they see that maybe you didn't sleep well, or you're scared, they're right there to tell you, it's okay, everything's gonna be okay, you can do this.